Okay, good afternoon, everyone, and welcome. Thank you for joining today's webinar, Quality Improvement in Community Mental Health and Addiction, Not Just Another Buzzword. This is actually part 2 of a collaborative webinar series brought to you by the Ontario Centre for Excellence for Child and Youth Mental Health and the Excellence Through Quality Improvement Project. And today we'll be focusing on QI Trailblazers. So before we get started, just a couple of housekeeping items. We are using the GoToWebinar platform today, so you should be seeing my screen now. Audio is available through either the computer or phone, so the call-in information for the phone can be found on the right corner of the screen, as well as the GoToWebinar window. Please let us know in the question or chat box if you have any questions or experiencing any technical difficulties. We've also attached a copy of today's slides in both English and French in the handout box, so you can go ahead and download those at your leisure. So all those joining through the audio will be on listen-only mode, which means you're muted, so please feel free to communicate with us via the questions box. And today's webinar will be recorded and definitely made available to watch on demand through YouTube and the Centre's website. We're also hoping to have everybody join us in the conversation today. So following some of the initial content, we'll be switching to an interactive question and answer session with our panelists, and we'd like you to join the conversation. You can join in using a mobile device or by opening another tab in your web browser and following the link on the screen there in number 2. We'll also be dropping the link in the chat box so you can link it through that way, and it'll be throughout the slides in case you miss it. So for those using a smartphone, you can also open up your camera function on the phone and point it towards the QR code, which is that squiggly box in the right-hand corner. And then you can use those phones, if they're compatible, to prompt you to open up the link directly. That way you can navigate to the web page. If your phone is not compatible, not to worry, you of course can still use the link provided to get to that poll software. And today's webinar will focus on a common question that teams and organizations who are new to quality improvement work ask, and that's, where do we start? So over the next hour, our panelists will be sharing how an existing problem or opportunity may prompt a team or organization to initiate quality improvement work. They'll also be helping to describe what steps should be taken when starting a quality improvement project, as well as discussing how data can help tell your story. And speaking of our panelists, we're very excited to have Cheryl Shute and Ian Payne from Community Withdrawal Management Services of Renfrew County and Natasha McBrearty from Crossroads Children's Mental Health Center joining myself, Alex Clement, a quality improvement coach with the Excellence Through Quality Improvement Project, and Blake Davey, a QI specialist from the Ontario Centre of Excellence for Child and Youth Mental Health today. So Natasha and Cheryl will be sharing their quality improvement stories with us very shortly. And just quickly about the hosts today. So the Excellence Through Quality Improvement Project was born out of a need for QI leadership and capacity building within the mental health and addiction sectors. The project is led by Addictions and Mental Health Ontario, as well as the Canadian Mental Health Association Ontario branch, and delivered in close partnership with Health Quality Ontario, soon to be Ontario Health, and the Provincial System Support Program at CAMH. The project itself promotes and supports the use of evidence-based assessment tools to do quality improvement work and aims to improve mental health and addiction care in the community. And with that, I will pass things over to Blake.
All right, thanks for getting us going today, Alex. I'm going to be keeping it brief. I'm going to talk a little bit about the Ontario Centre of Excellence for Child and Youth Mental Health, which is where I work, and I'll be talking a little bit about quality improvement and quality as well. But the real exciting part of today is we have some panelists that work in the child and youth mental health sector and in addiction sectors, and so I want to be keeping my conversation brief so we can turn it over to those folks. So the Centre has been supporting the child and youth mental health sector for over 15 years. And we have a long history of supporting the sector around quality and in the area of quality. And mainly our supports have been coaching and consultation supports, but we have also provided some grants to help with the coaching and consultation supports in some instances as well. And the areas specifically related to quality where we've done some work are evaluation, performance measurement, the implementation of evidence-based practices, and quality improvement. And I don't think it'll be surprising, and I'm sure everybody who's on or following along with the webinar today, I'm sure they know that our sector has experienced quite a bit of change, and along with the sector, the center has been changing as well. So you'll see the slide is an infographic that kind of that goes over center support. At the top there, you'll see the two things that we're looking to do. We're looking to mobilize knowledge. Sometimes that's existing knowledge, and of course, sometimes we work with the sector to develop new knowledge. We're also looking to improve the quality within the child and youth mental health sector. We want to make sure that the services are as efficient and effective as possible. So we work with agencies to ensure that we're improving the quality. A couple other things I'll point out on the infographic. In the middle there, and for anybody who can pick it up in orange, those are the age groups that our services and supports target. So we're not a direct service providing agency, but we do work with direct service providing agencies, and our supports and services span those different age groups. And down there at the bottom, you'll see in teal, those are the primary areas that the center projects fall within. So I'm not going to spend any more time because, like I said, we do want to get to the panelists as soon as we can. But I will encourage people, if they want to know more about the center, to check out our website. And that website has recently been redesigned. So for those people, even those people who are aware of center supports, I encourage you to check out the website. It has all those same products you've come to expect from the center, but it's just easier to access and navigate. So towards the end of the webinar, we're gonna give you links to our website. I'm gonna ask Alex to jump ahead a couple slides so I can talk about what is quality improvement. So you guys all have that definition in front of you, so I'm not going to spend a ton of time going over it, but there are a few things that I'd like to highlight. At the top there, it talks about how quality improvement is a systematic approach to making changes. So what does that mean? Well, it's really about two things. Quality improvement in the different frameworks, they provide you with a roadmap and a series of steps to follow to make sure that your quality improvement project is going to be successful. And they also provide you with a toolbox or a set of tools to use to help with your quality improvement initiative. It's also about improving things for both clients and the system as a whole. It's about making things more efficient and effective. And the last part of this definition that I want to go over is the part at the end about the combined and continuous efforts of all stakeholders. Your quality improvement initiative can't be successful if you're not engaging those people that are receiving the services, those that are delivering the services, and those that are planning and making decisions around those services. So on the next slide, we're going to look at all the different frameworks that are available, but all these different frameworks are they're all very similar. So that's something that we want you guys to keep in mind. But they all do have that element of it's really important to be engaging stakeholders, and they give you tools to help you engage those stakeholders and get information from them. So again, these QI frameworks, we don't put them up there to scare everybody. We just want to let you know what's out there, but there's a lot of similarities between these different frameworks, and no matter which one you choose, they're very similar in nature. So I'll ask Alex to jump ahead. So this is the last thing I'm going to go over before I turn it over to our panelists. And so these are a whole bunch of different words that you may hear when you're talking about quality. There's quality improvement, there's quality assurance, there's performance measurement. And similar to the last slide, we're not putting this up there to overwhelm people. We're just putting it up there to help them a bit with the language and distinguish between some of these things. And I encourage you to think of these as functions. If you want to ensure you have true quality, you want to make sure that you're doing all of these things, no matter what you call them at the end of the day. So you want to make sure that you're doing quality assurance, that you have the standards, guidelines, and targets established, and you want to make sure that you're doing performance measurement as well. So you want to measure whatever you're changing. So the performance measurement component and the indicators are important as well. And I won't go over the quality improvement one because that's what we've been talking about and we'll continue to talk about today. But it's just important that you're doing all of these functions, and we just wanted to present these because sometimes these are jargon and words that people get presented with. So we just wanted to give people this, and you'll have this to refer to as well. So I'm just going to turn it over now actually to our first panelist. And I won't say much about her because she'll do a much better job introducing herself than I will, but it is Natasha from Crossroads.
Thank you so much. Yeah, so my name is Natasha McBurdy. I'm the Associate Executive Director at Crossroads Children's Mental Health Center, and we work in Ottawa. And our work is with children under 12 and their families, and we have a wide range of mental health services to help children and families who are struggling with emotional, behavioral, and social challenges. So our services, they range from home-based services to services in the schools or in child care centers. We have a walk-in clinic, therapy service, and they go from intensive to lighter touch. And the majority of our funding is through provincial dollars. So we were funded initially for a long time by the Ministry of Children and Youth Services, and we've recently moved to the Ministry of Health. And in terms of our size, our team hovers about 50, which are mostly children and youth workers, social workers, and then some master's trained psychotherapists. And really, thank you for inviting me to do this, because we are just sort of finding our way through the QI world and training in Lean. And so it was really a wonderful opportunity to be able to present a little bit about what our journey has been like as we started on this mission to reduce our cancellations and increase our occupancy rate. So to tell you a little bit about the project, and maybe we'll just go to the next slide. About a year ago, we really started intentionally working on a QI project to increase our direct client contact and program occupancy. So essentially, we wanted to make the most of our human resources, so our staff time, so that they were spending the majority of their time working directly with families. And as you probably know, especially with folks offering services in the homes, there's things like driving and paperwork and attending meetings and going to committees and all that kind of stuff that takes away from the time staff spend directly with clients. So I'd say there's been a number of factors driving these improvements, and they've been more or less salient over time. But about a year ago when we started this project, we had a good look at our service requests, and we realized that since 2012, our requests for services had gone up 104%. So on the one hand, that was really great news, because it meant that people were more aware of early childhood mental health and, knowing that there were benefits to getting early intervention. But unfortunately, as you can imagine, our funding didn't go up 104%. So we really had to think about how we could do more with what we currently had. And then in addition, we had at that time a new government, and we knew we were transitioning to a new funder. So, we knew there would be some changes in terms of funding and targets as we move towards the Ontario Health Team model and whatnot, or at least we imagined or anticipated that there could be some changes there. And then finally, as a community, this was something that was really front and center, because we knew that access was a real issue for families in our community that had been identified through our community mental health plan. And so there'd been a lot of exploration and implementation of innovations like the choice and partnership approach, which is better known as CAPA, which is really focused on demand and capacity management. And so as we started to delve into CAPA and look at our own needs in terms of capacity, we started to look more closely at, what was actually happening. So, when you look at the number of hours you actually have in terms of staff time versus how many are going to direct client contact, we'd been aware of that and monitoring that, but I don't think we were sitting with it in the same way that we did once we started our QI journey. So our goal was really to identify opportunities to eliminate as much of the waste from our processes as possible. And by that, I mean activities that weren't directly adding value from the perspective of our families, or, those activities that maybe weren't adding value, but that we knew we had to fulfill to meet our funding requirements. So I'll just move to the next slide. So in terms of the process, once we identified the problem as a leadership team, we had a lot of assumptions about what might be happening and what might be taking away from staff being able to spend the majority of their time in direct client contact. So as a first step, we decided that we needed to set some time aside for quick quick meeting huddles. And that was really to create this space so that we could start to understand what metrics we needed and to figure out what our current state was. And, this wasn't a meeting. It was supposed to be a quick huddle where we would check base, and it was really about keeping it front and center in the beginning because we had so much to discuss. They weren't that quick, but we're getting better as we move through this process. So again, the purpose of the huddle was to do a quick weekly check-in to review our occupancy and our direct client contact. And what I just want to put out there, we were constantly reviewing caseloads and making sure that we were meeting and exceeding funder targets before we started this. But I don't think we'd ever poured over caseloads week to week as a team with the same intentionality to understand things like trends in scheduling, why people were being extended, the splits between the demand for evening and day appointments, where time was being lost, and all of those different factors. So now we were doing it together with the goal of understanding and generating solutions. So that's the other thing, is I think in the beginning it was, we were really trying to discover, and then, we found ourselves sometimes making excuses, and then we really had to be intentional about moving into generating solutions. So what we did realize as we started to use our data more effectively as well is that we had good data, but we had it in a lot of different places. And so once we started to get clear about the kinds of questions we were asking, we were able to bring together key metrics to really paint a picture of what our service delivery looked like week to week and month to month. And then, as we used the metrics, it generated more questions, so it was a completely iterative process of adding and taking away metrics to make sure that the report was streamlined enough and useful with the information that we needed to understand and inform decisions. So as a third step, because as I mentioned, we were immersed in lean thinking, we decided to hold a staff meeting or a Kaizen that brought together the expertise of everyone that was impacted by the problem. So that was, our reception staff, our frontline staff, our finance, everyone. And we really had a huge brainstorm about, the goal was how do we maximize our time for direct client contact and what's getting in the way. So staff from that meeting had a ton of ideas about why we weren't maximizing our time to see more client. And many of these issues fell within two broad areas. So one was that we really needed to think about reducing the amount of time spent on admin work. So that includes driving and the paperwork and all those pieces. But the other huge one was cancellations. So at that point, once we had all of this information, there was just so much that we could, set up as improvement projects. We decided that we really had to refine our scope and focus on a few key issues that would have either the biggest bang for our buck, or that would, because of their ease of implementation, be some quick wins. But what we're really focused on and what we prioritized was two main issues, and the one I'll focus on today was reducing our cancellations by 50% by the fiscal year end. So why? So it's such an interesting, and it continues to be for me, such an interesting conversation, because what the approach that we've taken, which is the root cause analysis of, why are we seeing these cancellations, has allowed us to pause and really think through what's happening. And I think this was just such a valuable exercise, because I think when, you finally identify an issue, it's just you quickly start to slap solutions on that issue. So this is one where it's easy to look at weekly outputs and say, oh, well, family just didn't show up. But unless we're tracking the kind of data that helps us understand who's canceling, how often they're canceling, who are they canceling with, for what service, how often, then, you start to see trends. And, while cancellations, one or two in a week on a caseload isn't, so significant once you add it all up, we really felt that was eating up a lot of our time and also having a ripple effect across the different facets of the service. So we went back to our metrics and we started tracking, why people are canceling, how staff are responding. So were they just offering an appointment the following week? Were they playing a game of telephone tag that would then result in a delay in service? Because we didn't have a standardized process, depending on which staff you asked, they were all handling it different ways. So that in and of itself is really interesting. And then what was also really interesting and continues to fuel conversation is how much our assumptions drive our solutions. So, for example, in conversations where the assumption was that families were canceling because they didn't value the service, then people started talking about clear expectations or motivational interviewing or things like that. And then others talked about, the issue is that families have too much to keep track of. So then that, generates solutions around having reminders and, texting before sessions and that kind of thing. And then others might, talk about, well, the family is just trying to make, ends meet and they have shift work, or they're embarrassed to have this in their home because they're in crisis, or their house is a mess, or, whatever the case may be. And all of those things create opportunities to talk about family engagement, but also the different barriers families face to accessing our services, and then all the wide range of solutions that would be appropriate for each of those different reasons. So as a result of the conversations, with our leadership team, the ongoing conversation with our staff team, everyone has had a heightened sense of the issue. And instead of just automatically rebooking, we started to have proactive conversations with families right up front using the initial session to say things like, here's our schedule for the next few weeks. I think, I know things can get busy. Is there anything that might get in the way of the sessions? So all kinds of work up front that would explore barriers and that would help families be put at ease that, it's okay if there's a crisis, that's why we're here. It's okay if your house is a mess, good parents have messy homes, like all those kinds of things that we could do ahead of time to set expectations or to proactively address potential cancellations. And then when there's cancellations, we're working with staff to really have those deeper conversations to understand why and hear the family's concerns and really try to problem solve with them around how we can reduce those cancellations. We've also got staff trying to rebook those canceled appointments within the same week. And then sometimes, doubling up in a week if we've missed a week to make sure that we're able to offer consistent and frequent treatment, but also that we're not extending treatment that results when there's been multiple cancellations, because we know that also has an effect on access for the next family who's waiting in line to receive that service. So, unfortunately, we haven't by any means flatlined our cancellation rates. I would say that we're experiencing a significant downward trend at this point, and it's really front and center in all of our minds. So I think that plays a big part in helping us move towards the reduction that we're seeing. And we're also paying a lot of attention to sustainability with the changes. So I think, what we don't want to see is like, now that we're paying all this attention to it, we're seeing a reduction, but as soon as we kind of look away and get, focused on something else, they'll creep up again. So what we're doing is we're developing standard operating procedures so that everyone is handling cancellations in the same way. And, it's been surprising to me how much staff have bought into this. And I think because we're collaborating on tools such as scripts or emails that could be sent to parents, or just brainstorming different ways of handling different situations, that I think is supporting and equipping staff to address this issue, directly. And then overall, I'm just, it's been really interesting to just see as a team, like what can happen when people start to get more curious. There's a lot of empowerment, people see change, and they start to question the status quo and look at what other things we could be addressing to improve the quality and availability of our services. So I guess that's about it for me. I'll leave it there, and then we'll move into a question period. So if there's any questions, you can send those my way.
Great, thank you so much, Natasha. Perfect, thanks, Ian. It's all yours.
Perfect. Hey, everybody. My name is Ian Payne. I'm the intake worker at Community Withdrawal Management Services. We're super thankful, to have this opportunity, and we're thrilled to be able to share our QI journey with you. We hope that we can sort of give you some pointers along and take from our successes and hopefully incorporate into yours in the future. So we'll just go over a bit of a lowdown of our agency. So we've been around Renfrew County in North Lanark for the past 12 years. So our mission is to provide a safe and supportive client-centered community-based withdrawal management service to the community that's accessible and it's culturally sensitive to the needs of Renfrew County residents. So as an outreach program, we can meet in our clients' homes, in our office, hospital, anywhere in our county. So we do like to think of ourselves as the first door, the first point of contact. We're able to administer assessments, referrals to different community agencies, mental health, our partner addiction agencies, basically whatever, our client needs. So our staff, we're 2 full-time staff. We're either members of the College of Social Service Workers, Social Workers, or the Canadian Addiction Counselor Certification Federation. Next slide.
Hi, everyone. This is Cheryl. And again, thank you very much for having us here. I'm just going to go over just a couple of slides and explain what we did, and any questions or anything anybody has for us, we'll be more than happy to answer at the end of the presentation. So our project title was Increasing Referrals from Emergency Rooms to Community Withdrawal Management Services. This was lack of referrals and exposure to CWMS. Clients were not getting the support and monitored detoxification, causing repeat admissions and relapsing. Clients are in crisis in the hospital, tying up the 2, or actually 5 ER resources and not receiving the most effective care. Our service area covers 7,400 kilometers squared, so it's about the size of EEI, forcing a client to travel hundreds of miles, usually without transportation, causing them to go without services. So after working with E-QIP, our aim statement became by September 30th, 2017, 5 local hospital emergency rooms will increase referrals from 0 to 10 referrals. And the reason we use 0 to 10 referrals, I'll go into later on. The CWMS has been working extensively with one of the 5 ERs in the region to incorporate their service into our discharge summary. That's how far we've come. Our data demonstrates an increase of 227% in referrals from 2016 to 2017, with a further 22% from 2017 to 2018. This translates a leap from 10 clients in 2016 to 30 on each caseload given at any given time. This progress is still ongoing with the smaller hospitals. This project came about as part of the accreditation process at McKay Manor and the need to incorporate quality improvement as part of McKay's strategic plan. It also came about as our executive director was at the time in 2016, had heard about E-QIP and that they had an info session in Ottawa, Ontario. And after attending this information session, he then contacted E-QIP to find out how they could help us in a more formal quality improvement. My role began initially as team lead, but after about 1 month or so, I started a new position as the coordinator for CWMS, so effectively becoming team lead as well as team member. Next slide. The project setup. This project was successful due in part to the training we all received from E-QIP and our executive sponsor, who understood the time and resources needed for the project and then took a step back and allowed us to have the autonomy to complete the project. Our team consisted of myself and my co-worker here, Ian Payne. We were very new to the quality improvement, and having a coach as well as a data coach that took us through the process step by step helped us form ideas and goals in a methodical way, which help us not only reach those goals, but surpass them. Data was very important, and we soon learned that there is always data. You just have to figure out where to look for it. And because of that, we were able to not only increase our referrals, but to track it as well. So again, thank you very much for having us here, and we're more than happy to answer any questions on about this towards the end of the presentation. Thank you.
Thank you so much, Cheryl and Ian, as well as Natasha. I mean, you've done a really wonderful introduction of today's topic around how to get started for quality improvement work. So now we want to switch gears over to the more kind of interactive portion of the session, which is going to be our Q&A. So for the audience, please grab your mobile devices or open up a new tab in your web browser. You can navigate to the link that I've shared in the chat box. It's also there on the screen at the bottom right-hand corner. And for those that are using a smartphone, you can use the camera feature pointed at that QR code. Again, that squiggly looking box in the bottom right-hand corner. And then if your phone is compatible, it should prompt you to open up the link through your web browser on your mobile device. So I'll give everybody a second to navigate that, and I will introduce our first theme. So in order to sort of guide the Q&A session, I know oftentimes we get to a question period and people are like, oh, well, I want to know more, but I'm just not sure how to phrase my thoughts or questions. We thought what we would do is kind of frame some questions in advance, open up a poll to see which ones people really want to hear about in terms of the theme, and to have our lovely panelists answer whichever question kind of gets the most votes and is kind of the burning question of the day. So if you've had an opportunity to navigate to the link, you should see that the voting is open now. So our first theme is inspiration, sources of QI projects, and scope. Our questions are, what made you and your team decide to take the plunge into a formal QI project? Another option is, how did you decide between the different projects and opportunity at your organization? 3 is, what, if any, role did data play in the early stages of your project? And 4, what steps did your team take to make sure they didn't bite off too much work? So again, once you're able to navigate to the poll, just choose your favorite option for our panelists to answer, press the vote button, and we'll have the panelists speak to the most popular question in a moment here. Oh, wow. It looks like everybody was able to find their way to the screen, which is fantastic. So it looks like we've got the most votes for what steps did your team take to make sure they didn't bite off too much work, with 50% of the votes. Thanks, folks. So, Natasha, do you want to maybe start with what your thoughts are around what steps did your team take to make sure they didn't bite off too much work?
Sure. In full transparency, I don't know that we've taken enough steps to make sure we haven't bitten off more than we can chew. I think this is a huge challenge, and it's something that we've been grappling with quite a bit. And actually, it was one of the reflections I had about this project, because the improvement projects are like onions. Like, once you start making an improvement in one area, you find that there's a whole bunch of other opportunities. It just unfolds into a million other things that you could pay attention to. And so I think one of the ways that I've been able to sort of, I would say, just curtail some of that extra stuff is keeping focus. So we started out with these broad problem statements. We kept refining it until we got to something really specific and measurable, which I think is so important. And then having that time carved out weekly, now it's just a 15-minute huddle, but it allows us to keep coming back to that initial problem statement. And I think what I've experienced in meetings, and I'm sure you're all better at this than I am, but we sit down for hours and talk around the issue, and then at the end we get up and we leave, and it's kind of like there's so much in there. It's hard to know what really to move ahead of and what's going to make that biggest difference. But I think what helps about having these huddles that are hyper-focused on a particular problem with a measurable outcome is that it forces you to come back to that and really focus your attention. And then, as we track those, because we have a list of quality improvement projects, we're also able to look at, okay, so, when we put all of this together, is this realistic? And then how can we prioritize this? And then finally, what I've been trying to do more intentionally lately is just making sure that what we are working on really is related to our strat plan. There are things that are really fun improvements and things we'd like to be doing, but I think that we're trying to make those linkages more clear to make sure that we're really focused in what we're taking on.
Thanks, Natasha. And Cheryl, any thoughts on what steps your team took to make sure they didn't bite off too much work?
Well, all following the steps of a formal QI, you have a coach, you have a data coach. They kind of keep you in line and keep you from jumping ahead or going in directions that aren't really where you should be at the time. Having a executive sponsor, in our case it was our ED, who understood the time that we needed to be able to do the quality improvement, as well as doing our job as well. So having him on our side, and understanding that part was huge. And even with the E-QIP team having a leadership workshops and stuff where it was better for him to understand so that he was able to implement that in the QI project. Mostly it's following the steps and not getting ahead of yourself. And that is, like I said, where the coaches and the data coaches all come into play. They keep you focused, like Natasha said, and staying focused on what works and what doesn't work, and being able to discard what doesn't work and have that conversation going forward and working with what does work. Ian, you got any thoughts?
Yeah, certainly. You know, I mean, I can only speak for our agency, but I mean, there's only 2 of us undergoing, you know, this QI. You know, very limited in how much time, you know, we have our own clients to serve on, you know, on top of this, and sort of having those checks and balances in place, like having a you know, a good QI coach, data coach, you know, our ED to kind of, you know, check in with us and, you know, make sure that, you know, things are on track and we're not spreading ourselves too thin. But, you know, at times, you know, it can be, you know, a little much, but again, you know, we sort of remember, you know, why we're doing this, and ultimately, you know, for the benefits of our clients, right? And yeah, that's pretty much it.
Great, thank you both so much. So we heard things around, you know, following a formal QI framework and making sure that you follow the steps, the benefits of having a concrete problem statement, as well as lots of open channels of communication like huddles, ensuring that you have executive sponsor backing and support, as well as making sure that it's related to your strat plan. Fantastic. Thank you both so much. And on to our next question. The theme is prioritizing and fitting it in. So folks will have a chance to select their favorite question out of the 4 here. So we've got what worked well in the early stages of your project, what aspects within your organization culture were particularly supportive when it came to starting a QI project. Third is what strategies were effective for securing the time and resources, human, financial, etc., needed to carry out your QI project, as well as how does your organization demonstrate that QI is a priority. So vote now, and I'll flip it over to our screen. It looks like we've got a couple of votes coming in already, and the forerunner is how does your organization demonstrate that QI is a priority? So I will get Cheryl and Ian, if you don't mind, starting us off on this one. The question is, how does your organization demonstrate that QI is a priority?
I guess what it comes down to is client-centered. Everything we do for clients, and quality improvement for us has always been to make it better for the client. And we demonstrate that by this project, for starters, is increasing so that our clients aren't falling through the cracks, as we like to call it. And we demonstrate that by, with this project, we now make, especially with the emergency departments, those clients are a priority because they're at the very early stages of recovery, and it's very important for us to reach them in a timely manner and not have them put off to when an appointment comes up. So with the QI, it is we meet them the same day or within a 24-hour period, just be able to get that going. QI is a priority by our agency allowing us to do what we do and giving us the time to do it and allowing us to reorganize our schedules. They also demonstrate that the QI was important is giving us the extra time because with client-centered, oftentimes what happens is office stuff gets put to the bottom. So whether it be doing reports or filling in catalog, whatever that is, they allow us to take extra time and give us the extra time to do that. They just whatever we need, they're there for us when it comes to QI. All we have to do is tell them this is what we need.
Yeah, definitely. And I think just speaking about our agency culture, I think you know, they're very supportive, and you know, we're always sort of like challenged and supported at the same time. So I think like sort of having that like nurturing background kind of you know, allowed us to kind of like buy into it, I suppose, and take the leap and, move forward with it. And as you can see, I mean, it works. So, yeah, no, I think it's just, it might be a bit of a broken record, but like, I think having a good agency behind you is certainly in my opinion, one of the biggest keys to success in QI. So.
Thank you, Ian and Cheryl. And Natasha, any additional thoughts?
Yeah, I would echo everything that's been said. I think the leadership buy-in piece is really huge. I know that we have really dedicated time, whether that's having staff come together to generate some solutions on issues that they identify as being important to optimal client care, or providing training dollars for staff to get their lean yellow belts or whatever that looks like. But I think where one of the pieces that's been so important for us is just that this is a shared responsibility, and that it's a culture piece, because I think, sometimes we can get caught up in blame when it comes to, why isn't this working properly? And so we've really had to do a lot of work on, it's not the people, it's the process. And that's been really instrumental for us in terms of our mantra to really engage folks. And, there are solutions that we can generate together to fix this process rather than blame each other or get frustrated or whatnot. And so it's having everybody buy in, and that really takes, I think, intentionality and resources and full leadership buy-in to kind of lead the way.
Great, thank you so much. So definitely heard the importance of a supportive agency culture. That kind of stems from, of course, having leadership buy-in, considering quality as a shared responsibility and avoiding blame, as well as, making their dedicated time available for quality improvement work, as well as sometimes training dollars for quality improvement as well. We also heard the importance of making sure the focus on quality is client-centered. So thank you all so much for that. We'll move on to our third question of the session, the theme being managing change. So the options here are: how did your clients react to the initial project? How did staff react? So how did your actions as a QI team impact them potentially? Number 2 is: what did your teams do to effectively manage situations when a sudden change in direction was needed? And 3, how was your project experience similar to other team successes you've been part of? So give everybody a moment to put their questions there. Ooh, so we have a split almost here. Maybe what we'll do is have each of you answer one question. So just looking here. Natasha, would you mind answering the questions around what did your team do to effectively manage situations when a sudden change in direction was needed? So number 2.
Sure, yeah. I think, again, in full transparency, we're not entirely there. I think there's a whole range of reactions. So you have your early adopters who are really engaged and really leading the change and helping to develop some of the standardized processes that we're going to adopt moving forward, which is great. And there are others who have more difficulty with change. I think one of the things that's also a little tricky, or one of the things that we've had some challenges navigating is, when you bring people together, people have different ideas, and then being really careful to say, this is what we heard from you, because I think it, we represent maybe a majority and not everyone. So really trying to navigate some of those differences between who is ready to change and move forward and make those quick changes, whereas others need certain skill or just more hand-holding, whatever that looks like. So we've really been focused as a bit of a phase 2 on a change management strategy. Lesson learned, that's probably something we'd want to do at the front end, but we're really seeing that not just on these, different change initiatives needing a change strategy, but even globally, because we are creating, in a culture of quality improvement, change is a constant. And so how do we really prepare people for that, and how do we assess what's needed, and message in a way that highlights what's in it for the client, what's in it for you as a staff person, what's in it for the agency and for our sector. And so I think those are all pieces that we're trying to pay more attention to as we engage in these rapid fire changes through these QI initiatives.
Great, thanks, Natasha. And Ian and Cheryl, do you mind answering question 1? How did your clients react to the initial project, and how did staff react? So essentially around how did your actions potentially impact these stakeholders?
Yeah, so the purpose of our project was to raise awareness of our program and sort of be that gateway to addiction services in our county. Like, as you know, like our county is quite large. Resources are somewhat limited to certain parts of the county. So I think, just in my experience with my clients, like having them know that there is services out there that they didn't know of before, during previous admissions, knowing that there are folks that are able to come to them. A lot of our clients, don't have transportation and are quite secluded. So, and I even think for the staff, I think having them see what we have to offer and what we're able to do for our clients to sort of curb that ER admission rate, I think they're quite surprised, and we were definitely a welcome addition to services that they offer. So yeah.
Yep, and I would have to say, with us being in the ER with our clients when they're going through substance issues, there seems to be, and I could be wrong, but a little bit more respect for the client themselves. And it just seems like the level of care goes up a few notches. And again, reaching that client face to face is huge for them, knowing, like Ian just said, that we are there and that we do care, and having that face to face contact, whether instead of being offered a business card, and said, here, contact this number when you leave, having us there just gets that little window of opportunity to reach the client that much faster.
You can build that rapport, and I mean, maybe they come in again, but that they can trust us, and like, we're there to help you. We have your best interests at heart.
And even for other stakeholders, because we're meeting those clients, we are getting them engaged in recovery, and then reaching out to other stakeholders in our communities for counseling, all the community things, that mental health and all that stuff. That is huge, because now they're increasing their clients through us, and they are referring back to us. So that, with our stakeholders, it just opened up the doors and became less of a silo effect within the community. So we're working more and more with our stakeholders within the community and becoming more and more case management than just one-on-one with these clients.
Certainly. Yeah.
Great. Thank you both so much. And just for the sake of time, I'm going to pass it over to Blake for our next question.
Great. I'm really excited about all the conversation that's gone on so far. We have a couple questions that we'll go over, or a couple more sections where we'll go over a few questions in each. The next one we'll talk about is setting your project up for long-term success, and the question options that we'd like you to vote on. The first one is, what actions, intentional or not, did you take early on in the project that contributed to your overall success? Question 2, when did you begin talking about sustainability spread? When would you recommend starting these conversations? And then lastly, how do you plan to evaluate your improvement initiative? Or if you've already done this, how did you evaluate it? So as the answers flow in there, it looks like there is a bit of a split on this one as well. People are interested in the evaluation being number 3, and that it looks like a split. And then what actions, intentional or not, did you take early on in the project that contribute to your overall success? So those are the ones we'll tackle. And perhaps I could start off with you, Cheryl and Ian, this time. And I'd ask you the first question. So that is, what actions, intentional or not, did you take early on in the project that contributed to your overall success?
Well, when I read this question, my mind immediately goes to finding the data. We didn't have any data, which in the beginning of this, I said we start off with our aim statement being 0 to 10 referrals. Because we didn't have any data, we thought. But working with the coaches, we found that we can find the data. And what we did was, it was time consuming, but we found time to do it, is we went back within a 1-year period and actually dug up all our clients that we've had in that year and who referred them. And by going in, it was time consuming. But once we had that, we were able to take that and actually put it into numbers, which we then were able to successfully increase going on forward. Also, what actions? I would also say that doing the PDSA, so being able to come up with some ideas and then trying them out and then eliminating them when they didn't work and going on to the different ideas. So that was so attending all the ideas and workshops and things like that, that made us successful.
That's great. Ian, did you have anything to add, or?
No, Ian just had to step out for a second, so it's just me.
Okay, perfect. So just to summarize what you went over, and just for anybody who might have missed it, we're talking about the first question. So that's, what actions, intentional or not, did you take early on in the project? And it sounded like you mentioned that data was a really important part early on, and actually realizing that you had the data when you didn't realize it in the first place. So going back and capturing that data. And you talked about the importance of the PDSA cycle and trying things out and then abandoning things that didn't work out. So that's great. And then Natasha, if I could ask you to speak about the last question, and that's how, and I guess it'd be, how do you plan, or you're in the works of planning out your evaluation. So what are you doing to plan your evaluation for this work, or how are you evaluating it?
Yeah, I don't think we're fully there because there's so many components that we could evaluate, but in terms of the actual improvement effort, the cancellations were more or less easy to measure because we were tracking them. And so tracking them over time, we can see an increase or a decrease, or things just remaining the same. So I think that's fairly easy. I would say that, you know, like the metrics, we have refined what we're looking for. So are the sessions being canceled by families? Are they being canceled by staff? So all of those pieces, but I think globally, you know, we can look at that as to the success. I think, you know, the tougher thing and where I would look for more support is just, you know, the QI initiative as a whole, like from a process perspective, and we certainly aren't there, but that's something that I would be interested in looking at moving forward.
Okay, that's great. And it was interesting that kind of both of you, I mean, this one is tied to evaluation, but it's nice how data came up in both those conversations. So I think we're set, and we can move on to the last question of the Q&A here. So it's looking back and moving forward. So this would be, what would the 4 questions you have to vote on, the first one being, what would be your advice for a team new to QI and hoping to start their own project? Question number 2, what was unexpected about the project experience? Question 3, what was your most memorable learning experience from the project? And then question 4 is, how have you leveraged your learnings in a way that will help your organization succeed? So I ask you to grab your smartphones and vote on these last ones. So it looks like we have a good split again this time. So that the split looks like it's between question number 2 and question number 4. So we'll go ahead with those 2. This time I'll go to Natasha first, if that's okay. And I'm going to ask you, what was unexpected about the project experience, Natasha?
I don't know if it was unexpected, but just the level of staff engagement was terrific. And I think, you know, people really generated so many ideas. and the conversations that happen as people are really getting curious about an issue open up more conversations. And so I think it's just how that is sort of contagious, right? How you sort of start with one issue and then you get in this momentum. And as people are talking, there's some solutions that are thrown out there that are just, well, why aren't we doing this? It doesn't cost anything. It's easy. We could do that right now. And so, you know, it's almost that ripple effect. As you're working on one thing, it sort of generates all these other improvements in other areas as well. And so I think that's what's really unexpected but wonderful about doing this in a systematic way and really having the conversations and getting curious about what's working well and not so well in an organization.
That's great. So it sounds like you were surprised by the level of staff engagement and the conversations, but it also, I think you touched upon the cultural piece as well, and the fact that, you know, you work on one project and then it kind of has a ripple effect. So I think that was really great. And then I will turn it over to you, Cheryl. And again, that's question number 4. How have you leveraged your learnings in a way that will help your organization succeed? Sorry, I just missed that, Cheryl.
We may have lost Cheryl.
Okay. Not a problem. I guess we can, at this point, because I'm checking the time here and we have a few minutes left, I guess we can move on from the Q&A. So I'll start off by saying that E-QIP and the center we've had some initial conversations about potentially having another webinar in the spring of 2020. We haven't planned too much in terms of details, but we do have our existing programs at the center here. If you tuned in the last webinar, if you follow us on social media, you would have probably heard about our Quest program that's kicking off in January. So we'll have agencies that we're working with that we could potentially spotlight during that webinar. And E-QIP has a program on their side as well that we could be promoting. So that's kind of the direction that we would be planning on taking a third webinar on. And so I encourage you to follow our social media, which I'm going to click to now to give you the links to that. So I encourage you to follow us on social media. We promote the resources we're sharing out. Those go on our social media as well as any program information, and we also promote a lot of the work that our great partners are doing within the sector. So we encourage you to follow us on social media. And then I also encourage you, if you're not a big social media person, you can also subscribe to our newsletters. The links to both of those are there, so I encourage you to check those out. The last thing I'd like to say here before turning it over to Alex to close off the day for us is the center has recently launched a new website. So for the people who are familiar with our old website but haven't been to our website in a couple months, we encourage you to check out our new website because it's more user-friendly and it's easier to find all that great info that's on there. So I'm going to turn it over to Alex to close her off now.
Thanks, Blake. And so just a couple other resources. E-QIP does have a YouTube page. We've highlighted some of our most favorite and most watched webinars here, so you can follow those links. The Center for Excellence has a ton of resources, whether it's policy papers or resources in terms of toolkits, infographics, you name it. Their website is a great link for that. The Excellence Through Quality Improvement Project does offer ideas quality improvement training. It's QI in a day. It is available. We try to do our best to provide it all across Ontario. So if you're following our social media or our newsletter, you'll see posts about that when we're hosting them in an area near you. Here's some E-QIP contact information. We have Debbie, our Director of Quality Improvement, as well as Ashley and Amy, our Program Managers, in case you have any questions for us that are E-QIP coaching or resource related. And we also have the contact information for the wonderful team over at the Ontario Centre of Excellence. So you see Blake there, as well as some of the managers, directors, and analysts, quality improvement specialists over there. So like a whole host of really resourceful folks if you need to reach out to them. We are going to be about 1 minute over time. Sorry, folks, but I just want to say thank you so much to our panelists for joining us today. Thank you to Blake, my co-presenter, and thank you for taking the time to join us and participating today. We hope you enjoyed the webinar. If you have a couple of spare moments before you need to run off, please provide your feedback in our 3 evaluation questions that I'm about to post on the screen. So we'd like to thank you again and have a really wonderful day. And they should be on the screen now. Great, so we'll just wait for a couple more seconds there before I flip it over to the next question. And question number 2. Great, and all your feedback, of course, goes towards helping ourselves at the Excellence Through Quality Improvement project, as well as the Ontario Centre of Excellence for Child and Youth Mental Health, develop content that's going to meet your needs and help you in your quality improvement journeys. Just give this one another moment or two, and then I'll have one final question. And again, just want to wish everybody a really great day. The question here is, please rate how likely you are to attend future webinars hosted by Centre for Excellence, as well as the Excellence Through Quality Improvement project. Great. And with that, I will be closing the webinar. So again, have a great day, everyone, and take care.